on as many cases as you could in a case series. So a third of them required hospitalization, and that's a fourfold increase in a hospitalization compared to other people hospitalized with flu rather. There were 6 deaths among these 34, and all of them had been previously healthy. So their only condition was pregnancy. All the deaths had viral pneumonia, and overall, at this time, when this analysis was done, 13% of deaths were in pregnant women. Only half had received antivirals, and only a quarter had received antivirals within 2 days of symptom onset. So the recommendation is, if you have an underlying condition that puts you at risk for complications, you should get treated as soon as possible, preferably within 72 hours of onset, really preferably with 48 hours. A lot of women, as we saw in our own data, went to the doctor and did not get treated quickly. And that's, I think, probably a combination of OBs being comfortable giving antiviral to pregnant women not wanting to take certain things while they're pregnant. But the data suggests that it really does make a difference and actually treat even if it's more than a few days since onset. So this is MMWR, and there are many MMWR articles that have come out from different states and other publications on H1N1. I think everyone's trying to get as much out there now as they can. But this is a series of pediatric deaths, and so this is representing 36 cases from April until August. And 50, so it's equal distribution of male and female. The median age was 9 years. And 67% had at least one high-risk condition, including one of those conditions would be being under 5 years of age. So then of those who had a high-risk condition, 22 of them had a neurodevelopmental condition. So that's really the highest risk kids. And a lot of it is kids or people who basically can't clear secretions, so they have difficulty coughing and clearing what they've accumulated during their illness. So these are many of them are very compromised people to begin with, and so it's not necessarily surprising. So nationally, the focus is on pregnant women. There's actually a specific hotline where we can call in 24 hours a day to consult with CDC on pregnant cases. And so we're doing follow-up on all severely ill pregnant women. So if a woman's admitted to the ICU with influenza-like illness and is not confirmed, we're going to do follow-up. Unusual cases or unusually severe cases, there have been anecdotal reports nationally of hemorrhagic pneumonitis, which is what it sounds like. So basically pneumonia complicated by hemorrhaging. And it's unclear whether it's a real increase or if it's just been a few cases, because it does happen with seasonal flu very rarely as well. So when things like this get reported to CDC, the states are all alerted to be aware of this. And if you hear something like this from a doctor, to report to CDC. So we report, still weekly our ILI data from the Sentinel sites. We report weekly our hospitalization and death data, and then any other indicators of changing severity. So if a hospital called us and said, wow, we've all of a sudden our ICU is filled with people with influenza-like illness. And we had a couple of calls like that in the spring, and it wound up not being accurate. It was, certain clinicians just having a different perspective as to what was going on. But it's important for us to be able to respond to that. School absenteeism is of note nationally as well as on the state level, and school closures. So everyone's scourging school closures, but some schools are going to close anyway. Some of them will close because they can't function. And so we've had schools that have had a third of their students out sick or half of their staff. And so if they can't actually function as a school, then that's fine. It's understandable for them to close. But some are closing basically because of parental pressure. Parents feel like they're not doing enough. Some of them will close just for a day or two, which doesn't really make any sense because it's not actually doing anything to stop transmission. Antiviral resistance is a national concern as well as state, obviously, and then waiting for the arrival of seasonal flu A, which will complicate treatment paradigms that are currently being used. And so I'll just go over these briefly, and feel free to ask questions at the end if you want about any of these things. So the current recommendation is test people who are severely ill, where there's a public health, potential concern. So basically, a case in a very fragile population. So there are some programs, some residential programs statewide that have very fragile patients in these hospitals, and so we would care to test people in those situations. we've actually been testing any reports of ILI in long-term care facilities among the elderly, because that would be very unusual. There haven't been any outbreaks among long-term care facilities, which is where you usually see outbreaks for influenza. Treatment is really indicated for people who are at high risk of complications or who are hospitalized. So if you have a fever and a cough and you go to your doctor and you're doing otherwise okay and you don't have any underlying conditions that put you at high risk for complications, you shouldn't get treated with antivirals. There's just no need for it. And so we're really trying to limit the use of antivirals just to the people who actually need it. Prophylaxis is really, it's the same groups. There's people who are at high risk of having complications from flu. So if you're a pregnant woman and your spouse has flu symptoms, then the pregnant woman should get treated with antivirals prophylactically. And then exclusion is really 24 hours after onset of fever, you should restrict your activities, not go to work, not go to school, and really limit all activity until 24 hours after your fever has resolved without using a fever-reducing medication. And it's likely that people will still be infectious after that period, but it's sort of the least aggressive, most effective balance, where you're trying to get people to limit their activity. But if you flat out say 7 days like we did in the spring, people don't listen anyway, because 7 days is a long time, especially for kids going to school or people missing work. So with 24 hours after fever resolution, that averages usually 3 or 4 days. And I think people are much more open to that. The only caveat to that is healthcare workers who should be out for 5 days after their onset of fever, unless they work with very immunocompromised patients, in which we would say 7 days. So I'm just going to touch briefly on some issues with H1N1 vaccine. Basically, this is really an unprecedented effort, not just for the companies making vaccine, but the entire structure of the system. So for seasonal flu, our state at least purchases some vaccine, and it's a very small percentage of the total amount of influenza vaccine in the state. But most doctors' offices privately purchase. And so if you're getting your seasonal flu shot at your doctor's office, they've purchased it themselves and they'll bill your insurance. The way the H1N1 vaccine is, the federal government is paying for all of it. And so it's zero cost to doctors and patients and to everyone else. But then the state health departments are distributing the doses, which we don't normally do. Again, we buy a very small percentage and we provide it to a very select group of people. So now all of a sudden we're responsible for getting flu vaccine to the entire state. And that's, normally with seasonal flu vaccine, CVS, Walgreens, all of these chains also have flu clinics. Well, they're not able to purchase H1N1 in the same way. And so it's a totally different structure. With that, the vaccine is not being made as quickly as hoped. And that's really purely a biologic mechanism where they can't produce the vaccine fast enough. The flu vaccine is made in eggs, and so there have been difficulties in the lab, and they're trying to produce both H1N1 and seasonal flu vaccine at the same time. So there's not enough vaccine. It's being distributed in a new way, and everyone wants it. And so basically the way the vaccine is coming out is CDC tells the states, this is how many doses are now available to your state. And I think we're getting emails 3 times a week, maybe even more. And then the people in our department have to figure out, using information on all the practices who have registered with us several months ago. So the information they provided would be, we're a pediatric practice with 5,000 patients, and a third of them have asthma, and 25% are under 5 or something like that. So using all that information, then we have to figure out who should get which doses. And then those practices get alerted, okay, these are the number of doses you're getting. They'll arrive in 2 days. And these are the people you should give it to, and it specifies who should get it. You should give it to, pregnant women in your OB practice, or it should go to, children with these conditions, et cetera. And then it goes to those practices. It never comes to the state. And so some of the practices, all the practices are doing the best they can, but it's not necessarily all perfect. It's not a perfect system. And so that's really the basic structure. At some point, there will be enough vaccine for everyone who wants it to get it, and there will be public clinics like there usually are for seasonal flu vaccine, but there's just not enough yet. So it's really for priority groups, and that includes people who take care of infants under 6 months of age, because you can't get flu vaccine unless you're 6 months or older. And so parents of infants who have very young infants at home, they should be getting vaccinated as well as siblings and that kind of thing. So that's the basic structure. I think it's evident then that there can be problems. And, obviously with there not being a vaccine, there are a lot of very upset people who want it and don't understand that they're just going to have to be patient. But I'll be happy to take questions about the vaccine in a moment, because you might have more questions. And I mean, just as a general note, it is made the same way seasonal